Tracy, first and foremost, thank you so much for trusting me with this question because I want everyone who has had breast cancer and they're experiencing vaginal dryness, I want you to understand that this is not something that you just have to deal with. There is things that you can do. If you're new to me, my name is Sherry. I'm certified in menopause health and hormone optimization, and I love to educate women so they can make informed decisions as they transition into menopause. So before we get into this, let's talk about why you're having vaginal dryness. Now, if you're in perimenopause or menopause and your estrogen levels drop, yes, it can definitely cause vaginal dryness. But then if you add on hormone blockers or chemo and other things, what happens is that it thins the lining down there. It reduces the elasticity that you have, and you also have less blood flow. And now all three of those things can reduce the amount that your body can lubricate your vagina. This is also called GSM, genitourinary syndrome of menopause. And it can affect everything. It can affect your comfort, right? Your desire, and even your confidence. I even have a lot of women, they tell me it feels like when they have sex, it feels like razor blades. It's just cutting them open. And that's horrible. No woman should have to feel that way. So what do you do to treat this? Now, a lot of women, when they start on estrogen replacement, then it helps relubricate, especially if it's something topical that you're putting down on the girly parts. It can help that lubrication come back. However, if you've had breast cancer, estrogen is sort of a no-no, especially systemic or any type of topical. So women who are in this situation, just like you, Tracy, they feel stuck because they're like, gosh, I'm miserable, but I want help, but I can't use the standard therapies that most women can have because of your history of breast cancer. Well, there are some options out there that can help you. First, there's medical grade vaginal moisturizers. Now, this is nothing that you get over the store. This is something that has to be prescribed to you that you can use, and it can help. Now, this is something that you want to use at least 2 to 3 times a week, not just when the dryness happens. You want to prevent the dryness. So this is why you need to do it 2 to 3 times a week, because this is going to help restore your tissues over time and hydrate them. So some things that you want to make sure that are in this product, you want to make sure there's hyaluronic acid, because that's going to bring water back into the cells, and then make sure that it's pH balanced and fragrance free. If it's not, then you're setting up for a whole other kind, complications, things like yeast infections and things like that, which you do not need. The second thing is that when you're having sex, you need to use some type of lubricant. And in my opinion, if you're having vaginal dryness, if with your history of breast cancer, this is non-negotiable. Now, when you're looking for some, you want to make sure that it's something that's clean. It doesn't have a lot of perfumes, irritants in it, because that can actually dry you out even more. And I like to refer women to something that is silicone-based because it's going to last a little bit longer. But just also remember that more is going to be better. You don't want to be stingy with this stuff. Number 3 is doing some type of pelvic floor PT. Now, I know that this is very underrated, but it really can be huge. And the reason why is because it increases blood flow to the area. And when you do that, it's going to reduce the pain, the dryness, and help restore a lot of that elasticity that your body needs. Now, I'm going to say this only because this is something that you can explore maybe further down the road with your oncologist. I'm going to say this again. It has to be explored with your oncologist to make sure that they're okay, because they look and see regarding to your breast cancer, how long you've been in remission, how you're doing with that, making sure that you're doing your surveillance and all your testing, because down the road, there are some oncologists that will allow a very low dose topical estrogen that you can apply topically to the area, or like a vaginal DHEA. However, this is case by case. This is not something that every woman can go out and do, because at the end of the day, your history matters, safety matters, and your quality of life matters too, right? So these are some options that you can use if you're in this situation where you're like, you can't use any estrogen. So Tracy, I hope this was helpful. Of course, if you have more comments or questions, please drop them below so that way I can answer them for you. And when it comes to menopause, make sure that you're hitting that follow button so that way we can continue to go on this journey together.